Why do you think there was this demonization of hydroxychloroquine? And why, I mean, do you have a theory as to why they would try to restrict the distribution of it, or why they would, if someone wanted to burn down the factories that produce it, why they would do that?
It was clear that hydroxychloroquine was the most promising drug that we had for COVID-19. By the way, we tested ritonavir, lopinavir, HIV drugs. They quickly fell to the side. Other drugs were tested, but hydroxy came forward as the lead agent. And currently we're up to 300 completed studies with hydroxychloroquine, 32 early treatment studies, and it does have an effect size or an efficacy early in treatment of about 64% globally across the studies, and its toxicity profile is well understood. Hydroxychloroquine, like ivermectin and the other drugs, are already FDA approved. The FDA tells doctors to use drugs off-label. It's in their guidance to us. And actually, FDA has a piece to patients that was published in 2018 saying, why does your doctor use off-label drugs? And it says when the doctors are fulfilling an unmet need, i.e. COVID-19. There's no new drugs for COVID-19. So we use these drugs, what's called clinically indicated, medically necessary, appropriate off-label use of drugs. Hydroxy was the first one up. A giant mistake was to actually place an emergency use authorization on hydroxychloroquine. And the original EUA that was placed on hydroxy, which it didn't need one because it's already on the market, right? It was placed for inpatient use. And then the interpretation was that it was the hydroxychloroquine was restricted at inpatient use. So once it became restricted at inpatient use, then there was messages saying, listen, don't use it unless somebody's an inpatient. Then when we found out that hydroxychloroquine, like ivermectin, works best early and has less of an effect late, like all the other drugs, because people are too far gone. Once those trials were completed, there's 5 randomized trials of inpatients with hydroxychloroquine as they're about to go on the ventilator. And those 5 trials are neutral. They don't show harm. They don't show benefit. They're neutral. One of them was the NIH trial. There's only 2 placebo-controlled trials, by the way. So we've based the entire house on hydroxychloroquine on 2 placebo-controlled small inpatient trials that didn't have sufficient power to see an effect if indeed it was there. Having said that, they were flat on the outcomes of mortality and progression in the hospital. And so based on that, in June of 2020, the FDA came out across the board and said, based on this, do not use hydroxychloroquine to treat COVID-19, period.